Hi, my name is Ashley Gallegos, and today I will be explaining the difference between a closed bed and a surgical bed. So a closed bed is usually used for nursing residents who are up for most of the day. So the top linens are folded back at bedtime, and the clean linens are used as needed. Also, for new patients or residents, the bed is made after the bed system is clean and disinfected. The clean linens are needed for the entire bed. So for a surgical procedure, bed making procedure, the top linens are folded to transfer the person from a stretcher to the bed. So usually the bed is left raised just so it's easier to transfer the patient from the stretcher to the bed. So these beds are usually made for people returning from surgeries, people arriving at the agency in an ambulance, people who are using portable tubs, and yeah. So also today I will be showing you guys how to perform a occupied bed. So the first thing you want to do is knock before entering the patient's room. Then the second thing that you will do is address the patient by their name. Then you are to introduce yourself and your job title. Then you are to explain the procedure that you will be doing today, and throughout the procedure, explain to them what you are doing, step by step. Then you are also to protect the person's rights throughout this procedure and also provide safety and don't be too rough on them, basically. So the first thing that you want to do is to practice hand hygiene and wash your hands. Then you are to collect all of your supplies. So I have 2 paper towels, my clean linen, the top and bottom linen, and then also gloves. So the paper towels, they act as a barrier when you put the clean linen on a surface. So I will put on my gloves now. Then you are to put your linen on a clean surface. So I am going to put my linen on a clean surface and make sure you are holding this away from you. You don't want the clean linen touching your dirty uniform. So after I put the clean linen on a clean surface, I am now going to make sure this is my patient, and I'm going to check their armrest. So it says John Doe. So it is my patient. Also, remember when you are checking linen, just make sure you are checking for dentures, eyeglasses, anything like that. So for safety, we are to put the rails up, both of them. So I am putting my patient's rail up, and then also on the other side. Then we are also going to make sure that the wheels are locked, because we don't want our patient to be rolling while we're making their bed. So locked the wheels. Now we are to remove the top linen of the bed. So just loosen it up, and now we are going to be folding the bedspread and the blanket. So first we will start off with the blanket. And, okay. So fold it away from your patient typically. So folding this. And then you are going to want to put the bedspread and the blanket on a chair. So I am going to be putting it on the chair now. And then we are going to be wanting to fold the bedspread as well. So folding it, then folding it, and then putting it on the chair. So now we are going to want to get a bath towel to cover up our patient while we take off their top linen, because we don't want our patient to be exposed when they don't have to be exposed. So we are going to put this on them. And then if your patient can't grab onto the bath towel, just tuck the bath towel underneath their elbows. So my patient can't grab the bath towel, so I'm going to be tucking it underneath his elbows. Okay, now we are going to be grabbing the top linen. So just grab it from the bottom up. Make sure you are not exposing your patients. Okay, so make sure you are folding it away from you and towards the patient. And then we are so this isn't soiled linen, so I don't need to dispose it, but I should discard it in the laundry bag that I did bring with my supplies. So I'm going to be putting it in the laundry bag. Now we are to make our patient on his side. So, and make sure when you are doing all these steps that you are explaining all of them to your patient or resident. So right now I would be telling him that I'm going to be making him go on his side. And when he is moving on his side, just make sure you assist him if he needs any help. So I'm going to help him. And then also make sure you adjust the pillow to their comfort. So now he is comfortable. Now we are going to be untucking the bottom linen. So untucked, and then we are going to be folding it, folding it towards the patient. And then my patient has a mattress pad, but it is not wet or anything like that, so I will not be replacing it today. But I will be unwrinkling it just to make sure there's no wrinkles in it. So unwrinkling anything. Now we will be discarding our gloves and practicing hand hygiene. Oops, I just took off my gloves the wrong way, so I'm sorry about that. And then washing our hands, and then just wear gloves again. If you, yeah, put on clean gloves. So now we are going to be placing the bottom sheet on that side of the mattress. So I am going to be grabbing my clean linen. I have gloves on, just these ones are inside out, so. So my linen, top linen. Okay. So make sure it's like that. And then we're using a flat sheet. So you are to be tucking the corners. So tucked, tucked. Then we're not using a draw sheet or a water pad, but if we were, you would be placing it in the middle of the mattress, and then you would be fan folding it towards the person. So now that we set up the bottom linen, we are to also, I forgot, when I was working on this side, I was supposed to take the railing off. So now I will be putting the railing back up on that side. So I'm putting this railing back up because now I will be moving the patient on that side. So also, you will be explaining to the patient that they are going to be rolling over a bump, just to reassure them that they're not falling or anything like that. So we are going to be helping the person roll over on the other side, and they are going over the bump and now adjust the pillow to their liking, to their comfort. Then I'm going to be lowering this bed rail because I will be working on that side now. So now we are going to be loosening the bottom linen on that side, and so untucking it, and then we are just going to fold it. And then this isn't soiled linen, so we are just going to be putting it in the laundry bag that I brought with my supplies today. Now we are to remove our gloves, discard them because we just dealt with the dirty linen and now there's just clean linen on the bed. So wash your hands and then put on gloves. So now straighten the mattress pad out, and then we are to pull the also their bath towel should still be on them. When I took off the dirty linen, I accidentally rolled this with it. So the bath towel would still be on them, and then they should be rolling over the hump, as in the clean bottom linen. They should also roll over that, not roll on top of it. So it should be like this, and my patients should still have the bath towel over him. So now I will be unfolding the bottom linen and tucking it in, and then we are going to be putting the patient in the middle. So just put him in the middle. Okay. And then we are to put the top linen over him. So I'm going to put the top linen over him, and then since my patient can't grab the linen, I'm going to be tucking it underneath his shoulders. Okay. Then we are going to be removing the bath towel that is underneath him. So remove bath towel, and then remember to fold it away from you. And then we are to discard this in the laundry. Now we are going to get the blanket and unfold it. So we're unfolding the blanket. And then also just make sure the crease is in the middle, and it covers the person. The upper hem should be 6 to 8 inches from top of the mattress. So now we are going to be getting the blanket, well, I mean the bedspread. So, getting the bedspread, and I'm just going to fold it this way. Okay. And make sure that just make sure the top hem is even with the mattress top. So also turn the top hem of the bed sheet, the bedspread, under the blanket to a cuff. And also the same thing goes for the top sheet as well. So now you are supposed to make a 2-inch toe pleat across foot to bed. Should be about 6 to 8 inches from foot of bed. So now we are going to be tucking in the sheets. So, well, the top linens. So, we are going to raise the mattress, tuck the top linen in, raise the mattress, top the linen in, raise the mattress, top the linen in, raise the mattress, top linen in. So, just remember, whatever side you are working at, that is when the bed rail should not be raised. And whatever side you aren't working at, the bed rail should be raised just for safety. So after all that is done, you could raise both of the bed rails. And then we are to straighten and smooth the top linen. So straightening that out. Okay. And now, since we just tucked in the bottom linen, we are to also tuck in the top linen. So raise the mattress, tuck it in. So the bottom and the top linen are tucked in, and make sure also that you leave the sides of the top linen untucked, and also the bottom linen. Now we are going to be changing the pillowcase, so I will be I will show you how. So first, this is my clean linen, and then you are going to want to make a V with the pillow, and then you are to, with your other hand, tuck it in, and then just work your way, making it, and then switch the pillows out. And then the pillow goes to the laundry. And that is how you make an occupied bed. And then also for what is it called? For post procedure, just make sure that your patient is comfortable, and then also put the call light back. So the call light, put it back, and then you can lower the bed, which I already lowered it, but you could lower it. You could raise or lower the bed rails depending on your patient. Just put clean supplies in their bedstand, like washcloths, paper towels, anything like that. You can unscreen the person. Make sure you complete a safety check before when you're checking the room, and follow agent policy when using linens. And always remember to practice hand hygiene. And that is how you make a preoccupied bed. Thank you.